Question 1. A 45-year-old male suddenly collapses in the workplace. You are the first rescuer to arrive. After ensuring the scene is safe, what is your immediate next step? A. Begin chest compressions. B. Open the airway using the head tilt-chin lift maneuver. C. Activate the emergency response system and get an AED. D. Check for responsiveness and breathing. Answer: D. Check for responsiveness and breathing. This question tests the initial assessment steps in the BLS sequence. The keyword immediate next step after scene safety highlights the critical first actions. After confirming the scene is safe, the very next action is to check if the person is responsive and if they are breathing normally. This rapid assessment determines if cardiac arrest is present and if CPR is needed. For example, if someone is just sleeping, they would be responsive, but if they are in cardiac arrest, they would be unresponsive and not breathing normally. Always remember to quickly assess the victim's condition before initiating further interventions or calling for help. Question 2. You are performing chest compressions on an adult. What is the recommended compression depth? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters. D. At least 2.4 inches 6 centimeters. Answer: C. At least 2 inches 5 centimeters. This question focuses on a crucial component of high-quality CPR, proper compression depth for adults. The phrase recommended compression depth directly asks for the specific guideline. For effective chest compressions on an adult, the sternum must be depressed by at least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters to ensure adequate blood flow to vital organs. For instance, shallow compressions might not push enough blood to the brain and heart. Always aim for the proper depth to maximize the chances of successful resuscitation. Question 3. While performing CPR on an adult, you notice the chest does not rise with your first rescue breath. What should be your immediate next action? A. Deliver the second rescue breath immediately. B. Reposition the airway using the head tilt-chin lift and attempt the second breath. C. Begin chest compressions again. D. Perform 5 abdominal thrusts. Answer: B. Reposition the airway using the head tilt-chin lift and attempt the second breath. This question tests troubleshooting during rescue breaths, a common challenge in BLS. The keyword immediate next action when the chest does not rise after the first breath is key. If a breath does not make the chest rise, it suggests an airway obstruction or improper head position, so you should quickly reposition the airway using the head tilt-chin lift maneuver and attempt the second breath. For example, if the tongue is blocking the airway, repositioning allows the air to enter. Always ensure a proper airway before giving the second breath, but avoid excessive attempts to ventilate. Question 4. You are performing CPR on an infant. What is the correct compression-to-breath ratio when there is a single rescuer? A. 30 compressions to 2 breaths. B. 15 compressions to 2 breaths. C. 30 compressions to 1 breath. D. 15 compressions to 1 breath. Answer: A. 30 compressions to 2 breaths. This question specifically addresses the single rescuer compression-to-breath ratio for infants, which is a common area of confusion. The terms infant and single rescuer are critical clues. Even for infants, a single rescuer should follow the 30 compressions to 2 breaths ratio, mirroring the adult and child guideline to ensure consistent, high-quality chest compressions are prioritized. For example, if a lone rescuer finds an unresponsive infant, they would start with 30 compressions, then give 2 breaths, and repeat this cycle. Keep the ratio consistent regardless of age when you are the only rescuer on scene. Question 5. You are the second rescuer to arrive during a cardiac arrest event where CPR is already in progress on an adult. What is your initial role? A. Take over chest compressions immediately to relieve the first rescuer. B. Prepare the AED for use. C. Ensure effective ventilations are being given. D. Confirm the emergency response system has been activated. Answer: B. Prepare the AED for use. This question tests the efficient use of multiple rescuers and prioritization in a cardiac arrest scenario. The keywords second rescuer and CPR already in progress on an adult are crucial. When a second rescuer arrives, the most beneficial immediate action is to prepare the AED, as early defibrillation significantly increases survival rates and avoids interrupting ongoing high-quality compressions. For instance, while the first rescuer continues compressions, the second rescuer can quickly open the AED, attach pads, and be ready to deliver a shock if advised. Always focus on bringing the AED into play as soon as possible when multiple rescuers are present. Question 6. A child collapses, and you are the first rescuer. After determining the child is unresponsive and not breathing normally, you should: A. Immediately begin chest compressions. B. Activate the emergency response system and then return to the child to begin CPR. C. Deliver 5 initial rescue breaths, then activate the emergency response system. D. Activate the emergency response system, get an AED, then return to the child to begin CPR. Answer: B. Activate the emergency response system and then return to the child to begin CPR. This question highlights the difference in activation sequence for pediatric cardiac arrest. The terms child collapses and unresponsive and not breathing normally indicate a likely cardiac arrest. For children and infants, cardiac arrest is often respiratory in origin, so after confirming unresponsiveness and abnormal breathing, activate the emergency response system first, then immediately return to the child to begin CPR, which includes chest compressions and breaths. For example, you would call 911 or direct someone else to do so, then begin the 30 compressions to 2 breath cycle. Remember, for children, always call for help before starting CPR unless you are alone and can't call. Question 7. You are using an AED on an adult. After the AED delivers a shock, what should you do immediately? A. Check for a pulse and breathing. B. Resume chest compressions. C. Disconnect the AED pads. D. Turn off the AED. Answer: B. Resume chest compressions. This question addresses the critical action immediately following an AED shock. The keyword immediately after the AED delivers a shock is vital. Regardless of whether the AED advises a shock or not, and immediately after a shock is delivered, you must resume high-quality chest compressions without delay until the AED reanalyzes, another rescuer takes over, or EMS arrives. For instance, if the AED shocks the person, you do not pause to check for a pulse, you restart compressions to maintain vital blood flow. Always prioritize continuous, high-quality chest compressions after any AED analysis or shock. Question 8. A conscious adult begins choking and indicates they are choking by grasping their throat. They are coughing forcefully. What is the most appropriate action? A. Perform abdominal thrusts immediately. B. Encourage them to continue coughing. C. Deliver back blows. D. Call 911 immediately. Answer: B. Encourage them to continue coughing. This question tests the crucial distinction between mild and severe airway obstruction in a conscious person. The clue coughing forcefully is the key indicator of a mild obstruction. When a conscious person is choking but can still cough forcefully, it means they are moving air, and their body is attempting to clear the obstruction naturally. your most appropriate action is to encourage them to continue coughing, as their own efforts are often the most effective way to dislodge the object. For example, if someone is coughing after swallowing food the wrong way, tell them keep coughing, rather than intervening physically. Only intervene with abdominal thrusts if their cough becomes silent or ineffective. Question 9. You are performing CPR and are about to deliver rescue breaths. How long should each rescue breath last? A. Approximately 0.5 seconds. B. Approximately 1 second. C. Approximately 1.5 seconds. D. Approximately 2 seconds. Answer: B. Approximately 1 second. This question assesses the proper technique for delivering rescue breaths. The keyword "how long" refers to the duration of each breath. Each rescue breath should be delivered over approximately 1 second, ensuring that the chest visibly rises. Delivering breaths too quickly or too forcefully can lead to air entering the stomach, gastric inflation, which can cause complications like vomiting. For example, when you give a breath, imagine slowly blowing out a candle rather than blowing it out quickly. Aim for a gentle breath that makes the chest rise without excessive force or speed. Question 10. When checking for a pulse on an adult, where should you palpate, and for how long? A. Radial artery, for no more than 5 seconds. B. Carotid artery, for no more than 10 seconds. C. Brachial artery, for at least 5 seconds. D. Femoral artery, for at least 10 seconds. Answer: B. Carotid artery, for no more than 10 seconds. This question assesses the correct location and duration for a pulse check in an adult. The keywords adult, where, and how long are critical. For an adult, the carotid artery in the neck is the most accessible and reliable site to check for a pulse. This check should be performed for no more than 10 seconds to avoid unnecessary delays in initiating chest compressions if a pulse is absent or questionable. For instance, after determining unresponsiveness, you would gently feel for a pulse in the groove beside the trachea for several seconds. Remember to check for a pulse for a short duration, as time is critical. Question 11. Which of the following is an example of an agonal gasp? A. Regular, slow breaths. B. Deep, snoring breaths. C. Occasional, noisy gasps that sound like snorts or snores. D. Rapid, shallow breaths. Answer: C. Occasional, noisy gasps that sound like snorts or snores. This question tests the recognition of agonal gasps, which are often mistaken for normal breathing. The term agonal gasp is the core concept. Agonal gasps are not effective breathing, they are isolated or infrequent gasping sounds that may occur in a person who is unresponsive because they are not providing adequate oxygen. For example, a person might make a loud, single gasp every few seconds, which can be misleading if you think they are breathing normally. It is crucial to recognize that agonal gasps are a sign of cardiac arrest and require immediate initiation of CPR. Question 12. You are preparing to use an AED on an adult male who has excessive chest hair. What is the best immediate action to ensure proper pad adhesion? A. Place the pads firmly over the hair. B. Shave the area where the pads will be placed. C. Use less adhesive pads. D. Moisten the chest hair. Answer: B. Shave the area where the pads will be placed. This question addresses a practical challenge in AED application and tests problem-solving skills. The key phrase "excessive chest hair" and "best immediate action" indicate the need for a solution that ensures effective pad contact. Excessive chest hair can prevent AED pads from making good electrical contact with the skin, potentially leading to an ineffective shock. If available, shaving the area is the most effective way to ensure proper pad adhesion and delivery of the defibrillating current. For instance, many AED kits include a razor for this very purpose. Always ensure excellent skin contact for the AED pads to work properly. Question 13. During a two rescuer CPR scenario on an adult, one rescuer delivers compressions while the other prepares to deliver breaths. When should the compressor pause for breaths? A. Only when the breathing rescuer states they are ready. B. Every 30 compressions, pausing briefly for 2 breaths. C. After 15 compressions, pausing briefly for 2 breaths. D. Continuously, without pausing for breaths. Answer: B. Every 30 compressions, pausing briefly for 2 breaths. This question tests the correct compression-to-breath ratio and coordination for two-rescuer adult CPR. The keywords two-rescuer CPR and adult are essential clues. In two-rescuer adult CPR, the guideline is to deliver 30 compressions followed by 2 breaths, with the compressor pausing briefly to allow for effective ventilations. For example, one rescuer would count aloud 1, 2, 3, 30, then pause while the second rescuer delivers 2 breaths. This ratio ensures a high compression fraction while still providing necessary ventilation. Question 14. You witness a pregnant woman in her 3rd trimester suddenly collapse. She is unresponsive and not breathing. When performing CPR, what special consideration should you keep in mind? A. Perform abdominal thrusts instead of chest compressions. B. Position the woman on her left side during CPR. C. Displace the uterus to the left side during compressions. D. Apply AED pads to her back to avoid the abdomen. Answer: C. Displace the uterus to the left side during compressions. This question introduces a specific consideration for CPR on pregnant individuals, making it more challenging. The phrases pregnant woman in her 3rd trimester and special consideration are vital. When performing CPR on a pregnant person, especially in the later stages of pregnancy, manually displacing the uterus to the left side helps relieve pressure on the major blood vessels, vena cava and aorta, improving blood flow back to the heart and to the fetus. For example, if you are alone, you can use a wedge or pillow under her right hip, or if another rescuer is present, they can manually push the uterus. This small adjustment can significantly improve the effectiveness of CPR for both mother and baby. Question 15. A 7-year-old child needs chest compressions. What is the appropriate depth of compressions for a child? A. At least 1 inch 2.5 centimeters. B. Approximately 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters. D. Approximately 1/3 the depth of the chest, or about 2 inches 5 centimeters. Answer: D. Approximately 1/3 the depth of the chest, or about 2 inches 5 centimeters. This question targets the specific compression depth guideline for children. The term child and appropriate depth are the key clues. For a child, chest compressions should be at least 1/3 the depth of the chest, which typically translates to about 2 inches 5 centimeters, similar to adults, but tailored to their smaller body size. For example, imagine dividing the child's chest into 3 parts. You want to depress the chest by one of those parts. Ensuring this depth is crucial for effective blood circulation to their vital organs. Question 16. You are performing CPR alone, and another rescuer arrives. What is the most efficient way to transition roles to ensure continuous high-quality CPR? A. The new rescuer immediately takes over compressions, and you start breaths. B. You finish your current cycle of compressions and breaths, then switch. C. The new rescuer sets up the AED while you continue CPR. D. You pause CPR, instruct the new rescuer on what you have done, then switch. Answer: B. You finish your current cycle of compressions and breaths, then switch. This question focuses on effective team dynamics and minimizing compression interruptions. The keyword most efficient when another rescuer arrives during solo CPR is crucial. The most efficient way to switch rescuers is for the current rescuer to complete their full 30 compressions and 2-breath cycle, then switch roles with the incoming rescuer. This minimizes interruptions to chest compressions, which is vital for maintaining blood flow. For instance, after you complete your 30:2 cycle, you can quickly move to the airway while the new rescuer takes over compressions. Always aim for smooth transitions to keep compressions going with minimal pauses. Question 17. Which of the following rhythms will an AED advise to shock? A. Asystole. B. Pulseless electrical activity, PEA. C. Ventricular fibrillation, VF. D. Bradycardia. Answer: C. Ventricular fibrillation, VF. This question tests knowledge of AED shockable rhythms, a critical BLS concept. The phrase AED advised to shock directly asks about the specific arrhythmias an AED is designed to treat. An AED is programmed to recognize and deliver a shock for two specific chaotic rhythms, ventricular fibrillation, VF, and pulseless ventricular tachycardia, private, both of which are considered shockable. For example, if someone collapses due to sudden cardiac arrest, it's often because their heart is quivering chaotically, VF, instead of pumping blood effectively. Remember, an AED will not shock asystole, flatline, or PEA because these are not chaotic electrical problems that can be corrected with a shock. Question 18. You are assisting an unresponsive, breathing adult who fell and hit their head. They are breathing normally, but you need to leave them to call for help. How should you position them? A. Flat on their back. B. In the recovery position. C. Sitting upright. D. With their feet elevated. Answer: B. In the recovery position. This question addresses the appropriate positioning for an unresponsive, breathing person, especially when their airway may be compromised. The clues unresponsive, breathing adult, fell and hit their head, and need to leave them to call for help indicate the need for a position that protects the airway. The recovery position, placing the person on their side, is used for unresponsive individuals who are breathing normally and have a pulse, as it helps keep the airway open by allowing fluids to drain and preventing the tongue from blocking the airway. For example, if someone passes out and is breathing, placing them on their side prevents them from choking on vomit or their tongue. Always use the recovery position for an unresponsive, breathing victim if you must leave them. Question 19. When should you stop CPR? A. When paramedics arrive and take over care. B. When you are too exhausted to continue. C. When the victim shows signs of life, e.g., normal breathing, movement. D. All of the above. Answer: D. All of the above. This question assesses the various valid reasons for discontinuing CPR, which is often a point of uncertainty for beginners. The keyword stop highlights the conditions under which resuscitation efforts can cease. CPR should be continued until one of several conditions is met. Trained medical professionals like paramedics arrive and take over, the victim shows definitive signs of life, such as normal breathing or movement, or the rescuer becomes too exhausted to continue effective compressions. For example, if EMS arrives and assumes control of the scene, you can safely stop CPR. Remember these criteria for when it's appropriate to discontinue resuscitation efforts. Question 20. An infant is conscious and choking but cannot make any sound. What is your initial action? A. Administer abdominal thrusts. B. Perform 5 back blows followed by 5 chest thrusts. C. Attempt to sweep the airway with your finger. D. Call 911 immediately. Answer: B. Perform 5 back blows followed by 5 chest thrusts. This question specifically tests the correct procedure for relieving severe choking in a conscious infant. The terms infant and cannot make any sound, indicating severe obstruction, are crucial. For a conscious infant experiencing a severe airway obstruction, the initial and most effective action is to deliver a sequence of 5 back blows followed by 5 chest thrusts. For example, you would support the infant on your forearm, deliver the back blows between the shoulder blades, then flip them over and deliver chest thrusts with 2 fingers on the breastbone. Do not attempt a finger sweep unless you see the object. Question 21. You are checking for a pulse on an infant. Where should you check for the pulse? A. Carotid artery. B. Femoral artery. C. Brachial artery. D. Radial artery. Answer: C. Brachial artery. This question focuses on the correct pulse check location for an infant, which differs from adults and children. The keyword infant is the main clue. For an infant, the brachial artery, located on the inside of the upper arm between the elbow and the shoulder, is the most accessible and reliable site to check for a pulse. For example, you would gently feel for a pulse in the infant's arm with 2 fingers. Remember that pulse check locations vary by age group to ensure you are checking the most appropriate site. Question 22. In a team resuscitation effort, which of the following is considered the most effective communication technique? A. Speaking loudly so everyone can hear. B. Using medical jargon to demonstrate expertise. C. Closed-loop communication. D. Assigning roles at the beginning and never changing them. Answer: C. Closed-loop communication. This question tests understanding of effective team dynamics, a vital part of high-quality BLS. The phrase, most effective communication technique, is the key. Closed-loop communication involves the sender giving a clear message, the receiver repeating the message back, and the sender confirming the message was correctly understood. This technique reduces misunderstandings and ensures tasks are completed effectively in high-stress situations. For example, if a team leader says, "Start compressions," the compressor would respond, "Starting compressions," and the leader would confirm, "Good, compressions started." This ensures everyone is on the same page and tasks are acknowledged. Question 23. What is the minimum rate of chest compressions per minute for all age groups, adults, children, and infants? A. 60 compressions/minute. B. 80 compressions/minute. C. 100 compressions/minute. D. 120 compressions/minute. Answer: C. 100 compressions/minute. This question targets a universal guideline for high-quality CPR applicable across all age groups. The keyword minimum rate and all age groups are critical. For all victims requiring CPR, including adults, children, and infants, chest compressions should be performed at a rate of at least 100 compressions per minute, but no more than 120 compressions per minute. For example, when performing compressions, you should aim for a rhythm that is at least as fast as the song "Stayin' Alive." Maintaining this minimum rate ensures continuous blood flow to vital organs. Question 24. After a person has been submerged in water and is unresponsive, what should be your first priority before starting CPR? A. Dry the person thoroughly. B. Remove wet clothing. C. Move the person to a safe, dry area. D. Call 911 immediately. Answer: C. Move the person to a safe, dry area. This question presents a scenario that emphasizes scene safety, even when a victim is in distress. The keywords "submerged in water" and "first priority before starting CPR" are crucial. Before initiating any medical intervention, including CPR, it is paramount to ensure the safety of both the rescuer and the victim. Moving the person from the water to a safe, dry area protects against further injury and allows for effective CPR. For instance, You wouldn't start compressions in a swimming pool if there's a risk of electrocution or drowning for yourself. Always prioritize your safety and the victim's safety by moving them to a secure environment first. Question 25. You are performing continuous chest compressions on an adult who has an advanced airway in place, e.g., endotracheal tube. How frequently should you deliver rescue breaths? A. 1 breath every 30 compressions. B. 1 breath every 6 to 8 seconds. C. 1 breath every 2 seconds. D. Do not deliver breaths, only continuous compressions. Answer: B. 1 breath every 6 to 8 seconds. This question tests a specific guideline for CPR when an advanced airway is present, which is often a source of confusion. The keywords continuous chest compressions and advanced airway in place are vital. When an advanced airway is in place, chest compressions should be delivered continuously without pauses for breaths, and rescue breaths should be given at a rate of 1 breath every 6 to 8 seconds, approximately 8 to 10 breaths per minute, asynchronous with compressions. For example, one rescuer would deliver compressions constantly, while another rescuer would deliver a breath every 6 to 8 seconds, without interrupting the compressions. This approach maximizes continuous blood flow while still providing adequate ventilation.